I should talk about the mumps virus, right? Right guys, so now let's talk about the mumps virus, right? So in the mumps virus, if you guys talk about, so here basically it is negative sense virus or it is a positive sense virus, guys. It is also a negative sense single stranded RNA virus, right, which we have talked about in the measles as well. So this is the negative sense single stranded RNA virus, okay. And if you talk about the, which family is it, this is the myxovirus, right? It is a myxovirus parotiditis, right? And we'll be talking about that here. In this case, we are seeing the parotiditis, right? That is one of the complications of this mumps virus, right? So that is seen. Okay guys, here what is the source of infection, right? For example, in the measles, we have talked about that measles cases are actually spreading the measles virus in the community basically, right? And we were not talking about the iceberg phenomena over there. We were not saying that they are the subclinical cases. Subclinical cases are very, very few, right? Carriers were very, very few, but there the cases were present in the measles virus. Here we are basically saying that clinical cases are present, and with that subclinical cases are also present. So here we will be seeing we will be talking about actually the iceberg phenomena, right? So over here, the clinical cases are actually spreading the virus. With that, we are having the subclinical cases also. And they are around 30 to 40%. 30 to 40% cases are subclinical cases. Next point over here, which we want to talk about, that here, will they show the iceberg phenomena? Yes, they will show the iceberg phenomena. Actually, in the simple rule, basically, just remember, whatever disease will be having, whatever infection will be having, the subclinical cases, they will be showing the iceberg phenomena, right? 0% subclinical case or very minimal subclinical case means very minimal iceberg phenomena. And we will be able to make it diagnose very clearly and with confidence, because we are having the clinical cases, they can be diagnosed easily with the clinical skills. But if the disease will be having subclinical cases, means we might not know many things which are happening in the patient and we might not be able to get it, right? That's why to make the diagnosis becomes very tricky at that point of time, right guys? So it will be showing basically the subclinical cases and they will be around 30 to 40%. Does it show iceberg phenomena? Yes, definitely it will be showing the iceberg phenomena. Definitely it will be showing the iceberg phenomenon, right? And that might be your MCQ as well, guys. So please remember that. Okay. So once we are clear with that, okay, some more points over here about this, right? For an example, if we talk about the period of communicability, right? If we talk about period of communicability, so 4 to 6 days before the rash and 7 days after the rash. Okay. So if these are the rashes present over there on the body, right? Okay. So 7 days after the rash, 7 days after rash, and 5 to 6 days, okay, before the rash. That will be your period of communicability, right? That will be your period of communicability. Okay, fine. Period of communicability, right? Okay guys, now if you talk about the secondary attack rate, in the measles also we saw that secondary attack rate was high, about around 80%, right? Here also secondary attack rate is on the higher side only, that is around 80 to 85%, right? That is around 80 to 85%. And one more thing over here is that, guys, if you talk about the incubation period, right? If you talk about the incubation period, I am writing the IP only. Incubation period will be 2 to 4 weeks over here, right? So a little longer as compared to the previous ones which we have talked about, chickenpox and the measles. Here this mumps virus is actually having the longer incubation period comparatively, that is around 2 to 4 weeks, right? Next point over here, usually it is affecting which kind of particular age group. So basically it is affecting the school going children, that is around 5 to 9 years, right? So it affects school going children, that is around 5 to 9 years approximately, right? Does it be having the seasonal trend? Yes, it is having the seasonal trend. Usually it is coming from winter to the spring, right? So usually spreads during winter, okay, during winter to the spring season, I mean around January to April and all, right? Winter to spring, right? At that point of time it is usually getting spread in the community basically, right? Okay guys, next point over here, how is it getting transmission? So usually transmitted through the droplets again, guys. So because it is a viral infection, so nothing new over here, usually transmitted through the droplets, and droplets I mean direct mode of transmission, right? So usually transmitted through the droplets, right? So here also it's getting transmitted through the droplets only. Okay, so next point over here, clinical features, guys. How you can be actually telling that this patient is having mumps or not, for an example. So clinical features, let's talk about them as well. Okay, so very non-specific symptom. First of all, I will saying the patient might be having high grade fever, but the very prominent sign which I'm telling you that is the parotitis or the parotiditis over here. So inflammation of the parotid gland. Okay, so inflammation of the parotid gland that can be appreciated in these kind of patient, right? So clinical features could be patient might be having the parotitis or parotiditis, whatever you want to call it. Okay, with that the patient might be having the fever, the patient might be having the other kind of glands inflammation, for example sublingual gland, submandibular gland. Okay, these kind of salivary gland inflammation can be there. So salivary gland inflammation can be there. Okay, with that tonsillitis can be there. Okay, so these kind of things might be seen in the patient, but main point which you wanna remember, that is I'm highlighting over here right now, that is a parotiditis or parotitis, guys. That you can't forget, right? Okay, what are the complications, guys, as far as this case is concerned? So complications are quite dangerous over here. Okay, or I would say very important as far as exams are concerned, for an example, because here you are seeing the inflammation of the testis if you are talking about the males, basically, right, male children. So orchitis might be seen over there, right? So orchitis is the main complication which you should remember over here. Okay, along with that there are many cases, right? For an example, pancreatitis can be there. Okay, and with that other kind of pancreatitis can be there. I told you that meningitis can be there, encephalitis can be, very non-specific features, but basically you should remember that orchitis is very important, right? Okay, so I want to highlight this, that is orchitis. Okay, so that is about the mumps virus, guys. However, at last, how you will be preventing it? Basically, treatment will be symptomatic management only, but if you talk about the prevention, right, we will be using the virus, we'll be using the vaccine over here. And which vaccine we are going to talk about over here. However, this mumps vaccine, basically it will be having the lower effectivity, but still we can use it for the prevention purpose, for the prophylaxis purpose. And basically we are using the Jaril-Lin. We are having different strains also, but most commonly used strain, that is the Jaril-Lin strain over here, right? So for the prevention part over here, for the prophylaxis purpose, right? So for the prevention part, okay, for the prevention part we are using what? We are using the mumps vaccine. Okay, however that is not very effective, having the lower effectivity, but still which we are using, that is the Jaril-Lin strain, right? We are using the Jaril-Lin strain. Okay, so that strain can be used over there. Fine. Okay, so once we have talked about that, okay, we are done with this particular mumps virus. Right now I'm going to talk about the rubella virus. Okay, now let's talk about the rubella virus. Okay, and that will be the fifth in our series. So rubella, let's talk about the rubella as well, right? You might have heard about many things about the rubella, right? Okay, so let's try to talk about the rubella virus. Okay, so here it is the which virus? It is a single stranded RNA virus, guys. First of all, this is also the single stranded RNA virus. This is not the DNA virus, this is the RNA virus only, and the family over here would be the Togaviridae family. Okay, this is the Togaviridae family. Okay, next point over here is that what is the source of this particular rubella virus. For example, in the measles I told you the clinical cases, in the mumps I told you the clinical cases, subclinical cases might be seen in the mumps but not seen in the measles, right? In the basically rubella, okay, we are seeing the subclinical cases also, we are seeing the clinical cases also, but basically clinical cases of rubella are actually spreading this. With that we are having the subclinical cases as well. We are having the subclinical cases as well, and subclinical cases are actually more higher as compared to the mumps virus over here. Okay, that is around 50 to 60% cases are the subclinical cases. So does it show the iceberg phenomena? You will say definitely it is showing the iceberg phenomena. Iceberg phenomena will be seen over here, right? Iceberg phenomenon will be seen over here, right? And that point I'm gonna highlight. Okay, right guys, so now what is the period of communicability in this case, right? What is the period of communicability? So period of communicability, okay, as we are discussing in every kind of disease, here also let me talk about the period of communicability. So basically 3 days before the rash and not the 3 days. So if you talk about the period of communicability, 7 days before the rash and 7 days after the rash. Okay, so for example, this is the rash. Okay, this is the rash present over there. Okay, so 7 days after the rash and 7 days before the rash. Okay, so that will be the period of communicability. Okay, what about the immunity purpose? Okay, so that is the in the rubella virus, we are saying that once the patient is having the rubella virus, it will be providing the lifelong immunity. Same with the measles also. If the patient is having the measles basically, or in the chickenpox also, it is giving the lifelong immunity to the patients, right? And the next point over here is usually it is not a very long period of disease, right? And it is a self-limiting disease. It is if it is coming in the lower age group, right? It is a self-limiting disease. It is a milder form of disease. But whenever it becomes severe, or whenever it is affecting the adolescent age group, or whenever it is affecting the woman reproductive age group, okay, at that point of time, the patient will be having the problem, because usually the rubella virus in the first trimester only, like the chickenpox virus, like the varicella virus, it can be transmitted from mother to the baby, right? So if it is if it is coming in the pregnant ladies, right, or if it is coming in the woman reproductive age lady and she is getting pregnant, that girl is getting pregnant, right, then the problems might be arising, because it can cause a congenital rubella syndrome, right? So over here, that is very important point. So guys, over here I can write that basically that it can be actually seen in the adolescent age group. Usually it is a self-limiting disease. It is a mild form of disease, right? Usually it is a self-limiting disease. It is a self-limiting disease, right? It is usually spreading. Okay, let me write it again. Yeah. So it usually spreads from during the winter and the spring season. Usually spreads during usually spreads during winter and spring, right? Usually spreads during winter and spring season. Okay, what kind of age group usually affected? Children only, 3 to 10 years of age group, right? And usually affects children, that is around 3 to 10 years, right? 3 to 10 years approximately. Okay, usually around 3 to 10 years approximately, right? Okay guys, now one more thing, what is the incubation period of the rubella virus over here? That is around 2 to 3 weeks, right? So incubation period over here, I'm just writing the IP, that is around 2 to 3 weeks. So we saw that incubation period was a bit longer in the mumps also, and here also we are seeing that in the rubella virus also the incubation period is a bit longer, right? Then if you talk about in the mumps virus, I forgot to tell you this parotitis appearance. So this is the parotitis appearance which you can see in the mumps virus basically. Okay, I was talking about the parotid gland involvement, parotid gland inflammation. With that, some other salivary glands inflammation might also be seen over there, right? So this is the parotid gland inflammation basically, what you are seeing on your screen right now. Basically, you are seeing that unilaterally the patient is having this much area getting swollen, right? So that is called as the parotitis, right? Which is actually appreciated in the mumps virus, okay? In the mumps virus I'm saying, okay? So in the rubella virus, I told you one of the complication part, that is the congenital rubella syndrome, okay? But I will be coming to this particular part, okay? Don't worry about that. I will be coming to the congenital rubella syndrome part. But before that, let me talk about some of the stages over here, right? As far as clinical features are concerned, we are talking about some stages over here. So let's talk about them as well. So if you talk about the clinical features of the rubella virus, right, we are having the 3 stages present over here. Okay, what are these 3 stages? So the first one which we are going to talk about, that is the prodromal stage again, guys. In the prodromal stage, nothing, we are seeing some non-specific kind of symptoms, as we are seeing that in the measles also. For an example, we can see the fever can be there, coryza can be there, like you are seeing in other respiratory viral infections or the viral infections, right? So in this particular stage also, prodromal stage also, you are seeing the fever might be there, or coryza might be there, might not be there, okay? Some patient diarrhea might be there, might not be there. These are some of the non-specific symptoms, that is a prodromal stage. Then you are having a lymphadenopathy stage. Here we are seeing that patients are having the lymphadenopathy. The patient is having the lymph node involvement, lymph node inflammation can be seen basically. And here we are seeing in the post-auricular region. In the measles, I told you that rashes will be starting from the post-auricular region. Here I am not talking about the rashes. Here I am talking about the lymphadenopathy. So the lymphadenopathy will be seen in the post-auricular region and the cervical region. So in these 2 regions, you will be seeing that lymph nodes are getting enlarged. That is the lymphadenopathy, right? So here we are seeing the lymphadenopathy stage. Lymphadenopathy, and lymphadenopathy can be seen. Lymphadenopathy, and lymphadenopathy might be seen over here. That will be seen where? Okay, so that will be seen where? That will be seen in the cervical and the post-auricular region. So post-auricular lymphadenopathy, post-auricular and cervical lymphadenopathy. Understood, guys? Very nice, understood. Now next point over here is, if we talk about the rashes, here also we are talking about the rashes. In the rubella also we are talking about the rashes, in the chickenpox also, measles also, in the mumps also. But basically in the mumps I told you the basic important feature, that was the parotitis, okay, and the complication was the orchitis, that was the main one. But here in this one we are talking about the rashes, and which kind of rash we are going to talk about over here, that is the very small kind of rashes can be seen, that is the pruritic rash, and there we will be seeing the itching in the patients, right? So usually the children are doing the itching in those kind of rashes, right? They will be starting from the face usually, and they will be going towards the periphery. So starting from the face and will be going towards the trunk region, right? Likewise, we saw in one more thing, that was the measles again, guys. In the measles also I told you that it was starting from the face and then going towards the trunk region, right? Okay, guys. Fine. In the chickenpox, what I told you, in the chickenpox, the rash was actually starting from the trunk region and then it was going towards the other regions. Okay, so that kind of difference you should know. So next point over here, so see, that will be the rashes in the rubella patients, right? In the rashes, what I told you, in the rashes, you know, the pruritic rash you will be seeing in the patients, pruritic small rashes you will be seeing in the patient, starts from face and then it will be moving towards the trunk region, okay. Once you are clear with that, then we should move on to the diagnosis part also, okay. So if you talk about the diagnosis part, how will you make the diagnosis on the patient? In this patient you might take the help of one particular test, that is called as a heme agglutination test, okay. So that is called as a heme agglutination inhibition test, heme agglutination inhibition test, right? Okay, with that you might take the help of the ELISA test, ELISA test, and this test basically is the ELISA antibody test, which is the ELISA antibody test. This is a specific IgM antibody you might check for, okay. Specific, you can check for the specific IgM antibody that will be telling you about the recent infection or the acute infection in the blood or in the body, or you might go for the IgG. So IgM, IgG, basically both of them are tested, okay, as far as this particular ELISA antibody test is concerned, okay. In pregnant females, you know, in the first trimester it can actually transmit from mother to the baby, so it can be showing the transplacental mode of transmission, which is again the direct mode of transmission, and there the babies might be having the congenital rubella syndrome. What is the congenital rubella syndrome? This is the congenital rubella syndrome, right? In the congenital rubella syndrome, what you are seeing basically in the congenital rubella syndrome, we are seeing that there the patient might be having the microcephaly, the patient might be having the patent ductus arteriosus, and the patient might be having the cataract, right? Here I would like to highlight one point over here is that in the, you know, the microcephaly is there in the heart part, okay, in the cardiovascular part, okay, the patient might be having the patent ductus arteriosus. Here the patient might be, you know, having the machine-like murmur, okay, machine-like murmur, okay. With that, the patient might be having the cataract, that is the eye part, okay. In some patient there might be the sensory neural hearing loss as well, okay. So they might be having the hearing loss as well, okay. So that is also very, very important, which you need to remember, okay, guys. So that is about the rubella syndrome, that is about the congenital rubella syndrome rather, okay. So that is about the congenital rubella syndrome, okay. So once you have understood that, okay, now we shall talk about the prevention part also, okay. So here I just talked about the transplacental mode of transmission, okay, and that is the congenital rubella syndrome. So this is the transplacental mode of transmission, okay, transplacental mode. So this is one of the complications which we might actually see in the congenital rubella syndrome patients, right? What about the prevention, guys? What about the prevention as far as these patients are concerned? So prevention, okay, so let's talk about that as well. So if we talk about the prevention, here we can actually use the rubella vaccine again. We might use the rubella vaccine, okay, rubella vaccine, okay. In the rubella vaccines, basically, you know, these are the live attenuated vaccines, and here we are talking about the strain that is the RA27/3. Okay, for example, in the measles, I have talked about the Edmonstone Zagreb strain. In the chickenpox, I have talked about the Oka strain, and here I am talking about the RA27/3 strain. Okay, so this is the live attenuated vaccine, guys. Live attenuated vaccine. Okay, if you talk about the strain over here, that is the RA27 by T strain. Okay, and if you talk about the dose over here, the dose will be the same, that is 0.5 ml subcutaneous. I told you over there itself. So 0.5 ml subcutaneous in right arm. Okay, in right upper arm. Likewise, I told you in the measles as well. Okay, right guys. Once we are clear with that, okay, at last a contraindication part over here. Contraindication again, same guys. In the pregnant females, you will not be giving this. The patient for the blood transfusion, you should tell them that for around 3 to 6 months they should hold for the blood transfusion products at that point of time. And in the immunocompromised patient, you will not be giving these kind of vaccines, right? Okay, so vaccines contraindication will be same for the measles also, and for the rubella also, and for the most of the viral infections also. So three complications which you should understand, that is, one was your pregnancy, other one was your blood products transfusion, and third one was your immunocompromised patient or the HIV patients, right? Okay, so that was about the rubella vaccines, right? Now we shall jump on to the MCQ section, okay, and let's talk about these vaccines, okay, or I would say viruses. So first question guys, in case of measles, basically post-exposure prophylaxis, okay, post-exposure prophylaxis, that was immunoglobulin, can be given within how many days after the exposure? How many days after the exposure, right? So basically guys, 3 to 4 days you should remember, 3 to 4 days you should remember, okay. So that would be the answer over here. So answer should be the right A option, right? That is the 3 to 4 days, okay, 3 to 4 days. Okay guys, next question. True about chickenpox infection. True about chickenpox infection. In the smallpox infection, I told you centrifugal distribution. Centrifugal was seen in the smallpox. Okay, but in the chickenpox, I told you what? In the chickenpox, I told you the centripetal distribution. So that should be the answer in this case, right? Okay guys, next question over here. Subacute sclerosing panencephalitis. They are talking about SSP, which is a late complication of, however, it is a rare complication, but it is a late complication of measles. It is a late complication of measles actually, okay. And chickenpox is infective, basically. Chickenpox is infective, what I told you. Basically, they are asking you the period of communicability. They are asking you the period of communicability over here. So I told you that if the rashes are present over there, right? Okay, I told you that 5 days after the rash and 2 days before the rash, approximately. I showed you the image as well. Okay, that is the period of communicability over there, right? That is the period of communicability if we talk about the chickenpox. So guys, over here, 2 days before, 5 days after the rash appearance, that is which option? That is your B option. So that will be the answer, 2 days before and 5 days after the rash appearance, right? So that is the chickenpox infectivity. Okay, so that's it about today's one. I hope you got some value out of this lesson, and I will be seeing you in the next video, guys. Okay, thank you so much. I will see you in the next one. Thank you.